overall for college-aged people. Jackson also felt a deeply personal loss with the suicide of a friend on the faculty. He decided to turn to his outside passion, photography, to help bring a stigmatized private problem into the open.
It struck me that the people who were suffering from depression and anxiety were still, as it were, in the dark. We'd made great strides in destigmatizing depression, but we still really just talked in terms of numbers. We talked about abstractions of mental health issues, and we would say this is normal and there are so many people who suffer from it.
Jackson put up posters around campus asking people to share their stories, and eventually interviewed and photographed some 24 students, as well as faculty and staff members. Emily Tang is now finishing her junior year after depression forced her to take a 2-year leave of absence.
I would just sit there wrapped in a blanket. The achievement of the day was I, got out of bed and I wasn't eating. It was like one meal a day. And that was usually like, somebody had bought something and come home and been like, eat this, please. Everything felt like there's like a layer of cotton or fog or something wrapped around my brain. And I just everything was just so blah.
The essays and portraits were first published in the campus newspaper, The Tech. They're now collected in a book, Portraits of Resilience.
I hope to capture the personality and charisma of the person that I was interviewing, the strength and the vulnerability. I wanted to make photos that weren't sensationalist, but that captured something of the depth of the individual.
The black and white portraits reveal a range of emotion. Haley Cope is a senior in Women and Gender Studies.
I can look at my experiences through the lens of my faith, and I can look at the experience of depression as a cross that I bear. And that gives a completely different view of the experience that I'm still grappling with.
Victor Morales battled depression as a student and after graduating.
Depression, whether it's the good or the bad, whether it's the happiness or the tears, for me, my depression was numb. I felt nothing.
The essays tell of different experiences and potential causes: genetic predisposition, traumas in their lives, a chronic health condition. And then there's the stress on today's students.
I think life is much harder for students today than it was when I was a student. There's so much pressure to perform. There are so many reductionist numeric measures of success. And this isn't MIT, this is everywhere, whether it's counting the number of Facebook likes you have, the number of times you're retweeted, your GPA, your internship salary. Kids now have resumes, when they're in high school.
Right. Measurements of how they're doing.
That's right.
And maybe failing.
That's right. Well, in fact, I believe it's not possible to succeed in this environment, because if you're measuring yourself day by day by all these, short-term ratings, eventually you won't measure up.
Jackson's answer: focus on the strengths and perseverance of people battling sometimes crippling depression, and the importance of friendships and loved ones to help them get through.
Well, I thought of it as a way of making a gallery of people who could stand up and say, this is me, and I'm proud of my experience. Not only am I not ashamed by what happened to me, but I'm proud to tell my story and to show that it's possible to struggle with depression or anxiety or whatever other mental health condition and reach the light at the end of the tunnel.
Jackson's book was recently given to all first-year students. For the PBS NewsHour, I'm Jeffrey Brown on the campus of MIT in Cambridge, Massachusetts.
Right. So, great. Yeah, so that video just resonates with me and puts a lot of things in context.
It is a particularly tense.
And I've actually also provided some links that are more specific to the Black community. There's a blog here that's been written about Black minority and ethnic postgraduate mental health. That is really good and points towards, I think they're more like resources, more in the UK. And then there's a good TED talk by a friend of mine who I met while I was actually doing my PhD. We did our PhDs together at Johns Hopkins. She's a psychiatrist and talks about the need for culturally sensitive talk therapy. And then there's a blog that I wrote called My Mental Health in Academia, that actually led to me being invited to speak with you today. Okay. So my mental health in academia, an open letter. I just basically share my journey because I found along my journey that just hearing other people's stories has really helped me a lot. Just finding people who've been through the same things I've gone through, who are willing enough to share, especially what they did to overcome, has been really helpful for me. So I wrote an open letter during the UK Disability Week, and I was interviewed by the communications department. So I didn't actually write it. The communications department actually recorded my interview and put it together. And it's really interesting because when they did post it, they said, look, if we get too many negative comments or if you're uncomfortable, we can always pull it down. But I've actually had very positive feedback and ended up, being invited to here to speak and being invited to other venues to speak about my journey. So my first crisis was in primary school. Towards the end of primary school, I was born in Kenya. My parents are Ugandan. And towards the end of primary school, we have a big exam in Kenya. It's a big exam to get into secondary school. And around the lead up to that, I had my very first crisis, but it was something that I didn't understand. My family didn't quite understand. And they just put it down to me being bullied, and my older sister and brother had graduated into secondary school the year before. So they thought maybe it's because her sister and brother have left. So in the end, I was pulled out of that particular primary school early and moved to the same secondary school that my sister was in. So it was a very fearful experience. I didn't quite know what it was, but just because of our cultural background and everything, it was not necessarily swept under the carpet, but the solution was just to move me to another school. I wasn't referred to a school psychologist or anything. We didn't really have that. And so I was then told I'm okay and just, act normal, you'll be fine. So I never really got to explore or really understand or resolve that whole issue, but I ended up with a lot of fear surrounding it. And now in retrospect, I know that if you don't really deal with a crisis well enough and you don't really resolve it, then you're walking around not really well. And the next time you hit a bump, it's gonna be worse. So it kind of lingers and it doesn't get resolved. So basically in secondary school, I did my O-levels in Kenya, and then my family moved over here to the UK. So towards the end of my A-levels, the same thing happened. I was, studying, going through the whole process of applying for university. I wasn't necessarily struggling with my A-levels, but was just studying a lot, having lots of late nights, not eating very well, and being in the UK with my first winter here, the first time I ever had a really bad bout of flu, I just got really sick and ended up having another crisis that again, we kind of swept under the carpet. So the solution then was for me to just go home and rest. I booked a holiday to Uganda to see my mother. My parents are from Uganda, so my mother had moved back to Uganda at the time. So I went home for this holiday, and again, the whole thing was kind of covered up and not dealt with. And then at the end of undergrad, I again had another crisis, with the end and the exams and the anxiety and everything. Had an anxiety crisis, did actually go to the school clinic and speak to somebody. And they said, oh, I think you're experiencing depression. Do you want medication? And somehow it just didn't register because, as Black people, it's something that we tend to think of as maybe a white problem, or white people, we're tough. We don't have those types of problems. So when she said that it was depression and said, do you feel you need a medication? I just said, well, I think I'm okay. And then I walked away from that whole situation. But then after I graduated and started my first job, I just really just slumped into this a really, really dark depression, and was kind of seeing and hearing things. And the landlady who I was living with at the time actually called my parents, who took me straight to hospital. So that was the first time I was hospitalized. And it's quite interesting because even that time, when I spoke to my care group and the doctors, and they did an assessment, they just said, "Oh, you've been studying too hard." And when they found out that my mother was in Uganda, they said, "Yeah, you just need to go home and rest, go and be with your mother." And the decision was made that, "Oh, let's get her a flight, let's let her go home, let her rest, she'll be fine." And the doctors at the time told me that, we don't want to give you a diagnosis. We don't want you to get caught up in the system. You're a student, you've been studying, just go home and rest. And I was given medication, but they said, we'll give it to your family and they can send you the full course of treatment. But the way things turned out, when I did go home, once I finished the medication I had, I didn't finish that course of treatment. And I mean, being home was very good. It's a nice environment. So I did feel much better and just continued, but then still had this underlying unresolved depression. So fast forward again to my PhD, and then I have another really huge crisis. So I've had 3 hospitalizations. But by the time I got to my PhD, I was at Johns Hopkins. I was actually starting to find out more. I was depressed. When I did, right from the start of my PhD, I realized that I was not well, and did actually go and see a doctor and start talking about it and trying to figure out what I needed to do about it. So just as a question, what are the signs of mental illness? If you can just give me one of the main signs or symptoms of mental illness that you know, and just put it into the chat. Can you hear me okay?
Yes.
Let me just try and bring up the chat here. Okay. Signs of mental illness. Okay, great.
I can read the chat for you if you prefer.
Okay. So yeah, feeling withdrawn, feeling fatigue. Yes, definitely. So for me, my signs, or what I now know as warning signs, are extreme exam anxiety, depression, which people don't define. Like when I was initially told depression, I didn't quite understand what exactly is depression. But just having a very low mood, having issues with my memory, extreme fatigue, fogginess, insomnia, loss of appetite, sometimes I have extreme energy and creativity. So I tend to have times where I'm very high energy, and then I will crash into depression. And during those times, I do feel isolated and lose my direction and lose motivation.
We have 2 comments in the chat, lack of joy and lack of motivation.
Yes. So those are the symptoms. And when you start to feel symptoms, then you should seek treatment. We have a lot of fear, and within the Black community, we tend to really delay before seeking treatment. And then even when we are offered treatment, we tend not to take it or only take it for a short while. I had a lot of fear of losing my mind, I think just from having had those episodes and never really had anybody to really talk through and resolve them. And with the way, I guess, our community, we tend to deal with it, we just want to brush it under the carpet. There's a lot of taboo and stigma. So I had a lot of fear, but then I suppressed it. And it just, the more you kind of suppress things, the worse they become. So there's a phrase that says, you're only as sick as your secrets. So as long as it's something that you're fearful about and you have a lot of anxiety about, the more it kind of controls you, and the more there's like a block towards it. But then when I did finally see a doctor and get the medication, and had a doctor who actually really calmly explained it to me and talked to me, and went through all the side effects, but said, it sounds like you've had a recurring issue that you've just never properly dealt with. You need to stay on these medicines for 6 months to a year. Otherwise, it's going to keep coming back and it'll come back worse. So I finally did get on medication. And if you deal with it early, that you can prevent having to be hospitalized and having to be forced into medication. But another thing I started to do, at least during my PhD, was looking into alternative therapies. One of my pastors on my churches was opposite or near a herbal shop. And it was a husband and wife who'd had this herbal shop in Baltimore for years and years and years. And my ex-husband and I went to see him, and we mentioned some of the things we were experiencing. My husband had been very ill, and he suggested that we go over to the herbal shop, and he actually walked us over. And he said, you know, these guys have really helped me. You should listen to them, take their advice. So it was a husband and wife team. They were very, very friendly, and just gave us some herbs, gave me some herbs for my insomnia that really worked. But then they had a pharmacology background, and I had done biochemistry, so I was able to really speak to them about antidepressants and the herbals and what the alternatives are, how they really work. And that really opened me up to the use of herbs and alternative therapies. So what are some of the treatments for mental health that you know about? Again, in the chat.
Oh, we can't hear you. We can't hear you. Can you hear us? We can. Sorry, Dr. Kibirige, we can't hear you. Can you hear us? Okay, I don't know what to.
I'm gonna try to restart. Okay. Let's see.
Yeah.
He's not responding.
I will email her real quick then. Sorry, everybody, for the technical difficulties.
Can you hear me now?
Yes. But you have background noise again.
Your video's on as well.
Hello, can you hear me now?
Yes.
Yeah.
Can you hear me?
Yes.
Hello, can you hear me?
Yes, we can hear you.
Oh no, oh dear. Oh, something's happened with the audio. I'll stop sharing for a while. Oh, you can hear me? Okay. Okay, so I've taken my headphones off, but that means I can't hear you. I've had this issue with Zoom before in my headphones, but I will continue talking because you can hear me, and then we'll figure it out at the end in terms of, yeah, I may need to put on my headphones to hear you, but if you can hear me speaking and there's no echo, then I'll continue this way. So sorry about all the technical errors. So yeah, group therapy for me, I found really useful, just knowing that you're not alone, knowing that there are others going through the same problem, hearing how they're coping, connecting with other people it is hugely helpful. And then there's things like aromatherapy, drops of lavender oil on your pillow at night is really good for sleeping. I find like grapefruit or citrus in the morning. I have a spray body mist that's citrus grapefruit. It's really good for waking me up and making me feel fresh in the morning. So things like peppermint are known to really enhance your mental, just wake you up mentally. And also spices, different spices or different foods actually have a lot of mood boosting and mental health supporting functions. So just finding out about all these foods and therapies and things that can support your mental health is really important, because the more you do to support your mental health, the less likely you are to get into extreme crises, and preventing or preempting a situation is much better than ending up hospitalized. So I found Chinese acupuncture and massage extremely helpful as well. It's not something I would have done in my own volition, but a cousin of mine recommended it to me and recommended me to her Chinese doctor, and it's been extremely helpful. I don't know if you've never had Chinese massage, there's a way of kind of massaging and realigning any spine or posture issues that you have. And one of the sessions I went to, it turned out that my spine was very misaligned, but particularly I had a lot of neck issues. And one of the sessions I remember, he particularly kind of realigned my neck and snapped my skull and my neck and like my vertebrae back into alignment. And it's amazing how much better I slept after that. And he said, yeah, you have, because your nerves go down into your back, and if they're misaligned, or if you have a pinched nerve, it actually can greatly affect your mental health. So it's not something I would have thought of, but actually acupuncture and massage has been very helpful. I've suffered particularly with insomnia. When I did my PhD, I was doing my research on a cohort of AIDS patients, and they came in after work, and the clinic would collect the samples and take them for what they needed for their routine cohort studies that they were the main studies that they were doing, and I would get any leftover cells for my actual research. So people would come in between 5 and 6, their blood would be drawn, and then the clinic would process the blood and give me what was left over. So I would tend to get my samples at 7, 8, or 9. And with the work I was doing, some of the processing had to be done that night. So I ended up in this routine for my PhD where I was getting my samples really late in the evening, having to process them through the night and get to that stage before I could leave the samples. So I ended up at night a lot. And for the first 2 years, I had my mandatory coursework, but I was being sponsored through the Ministry of Health, and it was an epidemiological program. So a lot of the courses they wanted me to do hadn't been part of my course requirements. So I ended up actually doing really heavy coursework for 4 years just to satisfy my sponsors, but ended up in a really unhealthy just pattern, because I was trying to do my lab work. I had all this coursework, and then I was having to work all these late nights. So at the worst of all of that, towards the end of my PhD, right before my last hospitalization, I had really terrible insomnia. I had 2 weeks when I couldn't sleep at all. And that's what led to the hospitalization. And one of the things that was offered to me during that, as a result of that, was a sleep hygienist. So I actually saw a sleep hygienist who helped me completely reorganize my room and reset my sleep-wake cycle. And since then, I realized the importance of just not getting into bad sleeping habits, or if you are getting into bad sleeping habits, just reorganizing yourself and getting out of it. So some of the things we did were completely declutter my room and separate my office and my home. So it was like, don't bring your computer home, or don't have it in your room. If you don't have to turn off your computer and allow yourself an hour before bedtime, get into routine, have a peaceful setting in your room, dim lights, soft music, just do a lot of things to calm yourself down and get you into a sleeping mode. And if you do that as a routine, eventually your body will be able to wind down. Every time you come into your bedroom, it will be a cue for your body to calm down, wind down. Or when you come home, it will be a cue for your body to wind down. So I avoid bringing work home. And if I do really try and separate office and home. It's a bit difficult now with the lockdown, but it's definitely something worth pursuing in terms of your mental health. So decluttering, developing a good work-life balance, calming vacations. I say calming because sometimes vacations can be a lot of activity, but it's good to have retreats where we actually break away from everything and completely calm our minds. Melatonin supplementation has been really good for me. Herbs and probiotics, and regulating alcohol intake. Diet and exercise, extremely important. Eating organic and clean. Supplements that support your mental health are vitamin D, omega-3 oils, CBD oil. I'm finding particularly useful at the moment. Heavy metal detoxification. Heavy metals actually greatly affect our mental health. In case you didn't know, mercury in particular, that's found in tooth fillings or in vaccines, can be very bad. Dentists actually have the highest suicide rate, which I just found out recently, but it's because of all the mercury they're exposed to. Finding an exercise for you that's calming. Swimming and walking are very calming for me, and making an effort to spend time in nature, particularly near water. I find water very calming. I live near the harbor right now, so I get out to the harbor. I found a pub where I can work. They don't mind me working. It's near the water. I live opposite a gym and swimming pool. It has a sauna, it has a steam room. So in the evenings, it's quite easy for me before the lockdown to just go and spend some time in the steam room and have a swim. And that's very calming. So seeking professional help, confiding in the right people, developing positive coping skills, and building an effective support network are all very important. So the spiritual dimension. Spirituality has been very helpful for me, and finding out about and getting actively involved in Christian meditation has been really helpful. Music, just having the right things playing in our minds, positive affirmations are really helpful. And recently I'm finding mindfulness very helpful. I have a book here and a link. It's an audiobook or a CD as well as an actual physical book, but it takes you through an 8-week course of mindfulness. So mindfulness it's actually been developed by a group of psychologists and refined over the years. It may sound like something really simple, just clearing your mind, but there's an actual whole technique to it. There's breathing exercises, there's a body scan. It's a way of really training your mind. And if you are very scatterbrained or you get foggy or find it hard to be still and peaceful and restful, it can be hard to get into, but the more you get into it, the more you reap the benefits. I've been having a lot of issues with my joints and my back, and I tend to tense certain parts of my body. And it's amazing how much your mental health can affect your physical health, because I've been experiencing a lot of pain. My left side, so my left shoulder, my hips, my knees, my foot, all on my left side, which turns out that is significant. Like your right side of your brain is connected to your left side of your body. But since I started doing the mindfulness and doing the body scan, I'm so much more aware of when I tense those muscles. So even at night when I sleep, I just it helps me stop tensing my muscles and get into a better sleeping position. So a lot of those aches and pains have actually been relieved since I started doing mindfulness. So just to give us a bit of a taster, I have a 10-minute mindfulness meditation that I would like for us to try. So if you can just get into a comfortable position, if you're on a chair, that's great. You want to have your knees slightly lower than your hips, and you want to lean back and forth and to the side and find the position that's just naturally very comfortable for you to sit still at without being tense in any particular position. And we shall do the mindfulness meditation.
One way to practice mindfulness is to
The sound is a little bit distorted. I'm not sure.
to make sure your head there's all that slightly.
Hi, can you hear me actually talking?
Relax.
Okay, so you can hear me talking. Okay, so I guess we'll skip that. We've kind of run out of time as well. There is a resource, a PDF of all these slides, and all the links work on the PDF. So if you do download the PDF, you will be able to access both the link to the book I'm recommending and to this meditation. If you've never done mindfulness before, I highly recommend it. So we've kind of run out of time. We have 12 minutes left. So I think we'll take a vote on whether we want to go out into breakout rooms and do a discussion, or if we want to do a 12-minute question and answer. So would you rather go into a discussion in groups, or would you rather stay in the main room and do some questions and answers? Quick vote, just put it in the chat. Breakout or Q&A? Let me see what you're saying. Breakout, are we going into breakout rooms? Q&A. Any more voting Q&A? Okay, so Q&A is great. I'm having this issue with my headphones, so I'll have to put them on to hear you and pop them up to speak. So I'm going to pop in the headphones and hopefully I'll be able to hear you. Okay, I have my headphones in. Speak to me, somebody. Hello?
Can you hear me?
Oh, dear. Hello?
Can you hear me? Just to see if your headphones are working.
Headphones completely acting up. You can hear me. I can't hear you.
Maybe if you have any
But
questions,
if you
just put them in the
type
chat.
into,
Yeah.
I can't hear you. I'm afraid no. See, this happens every time I switch back and forth between my headphones on Zoom. Yeah, just if you type your questions into the chat. I thought I had resolved this issue, but I always have this with Zoom in particular when I'm doing PowerPoints. Once I put my headphones in, the sound goes funny. But if you have any questions, just put them into the chat and I'll be more than happy to help. And I'm going to share, or the organizers are going to share the PDFs, the slides with you that have links to all the different things I mentioned during the discussion. So any questions? Okay, so question and answer. Have you found this workshop useful? Yes, yes, no. And are you likely to incorporate some of the advice into your life? So what things, okay. So there is a question now. Great. How do you think institutions can support researchers? We know the workload contributes, but this seems difficult to change. So let me go to this slide. In the article, let me open this link. The article, I give you the link to that I wrote called My Mental Health in Academia, this blog. It was actually well put together. Like I said, there was a ghostwriter. I was interviewed by the communication office. It was during the UK Disability History Month. And it does give slides, links to the different resources or different things that the Imperial College does to support mental health. And I have found the help I have received here through occupational health extremely useful. So I would say Imperial College is a good showcase of how an institution can support staff. Through our postdoctoral resource center, they actually offer a lot of courses on managing your mental health in academia. There's one-day workshops, there's actual courses. They actually have a trained psychiatrist who was in academia studying psychiatry, but then decided to become more of a wellness coach, run those. And I've attended some of those and they've been really helpful. We have our chaplaincy center that runs mindfulness sessions during the week. So there's a Christian chaplain who does Christian-centered mindfulness. There's a Buddhist chaplain. So through occupational health, I was referred to the mindfulness sessions that I started attending. The lockdown's been really helpful because a lot of these things have now become available through Zoom. So I've been able to attend more of the mindfulness sessions through Zoom. And I found them really helpful and asked if I could have a one-to-one coach, which my university provides for free. So I've been doing the one-to-one coaching and actually I'm starting to work through a course with the mindfulness coach. Imperial Confidential Care actually provides a lot of help and referrals. So there's a helpline you can call and they will help you find a good therapist and actually extend that support to your family. So I've actually found Imperial College really supportful. I was actually very, very much thinking that I needed to quit academia, that there's no way I could manage my mental health and remain in academia. But being at Imperial College has actually allowed me to continue to thrive and get better and continue to maintain my academic career. So yeah, that's my answer to how institutions can support. I've actually found with the lockdown, a lot of things are now available online. The mindfulness, some of it was online, but most of it you had to go to the South Kent campus, and I'm at a different campus, so I couldn't make the mindfulness sessions. So accessing online groups and tools and has actually been a really good thing during the lockdown. Any more questions? Any more questions? Let's see, what else did I have in there? So in the breakout rooms, I was going to ask, how would you describe your mental health journey and what things have stood out for you during the talk and that you like to incorporate into your life? And do you have any additional advice to offer? So yeah, if anybody wants to mention any particular thing that they are going to take away and incorporate into their life, just type it into the chat. Or if you have any additional advice, anything that you think I haven't covered, if you have a link or anything you want to share, you could put that into the chat as well. That would be lovely. Okay, yeah, any suggestions for wellness apps? From me, so the christianmeditator.com, I find really good if you're a Christian, even if you're not a Christian. She does yoga and all these, and mindfulness and CBT and tap therapy and a lot of conventional therapy, but she does it in a Christian context. So I found that really helpful. The mindfulness book, this book is extremely helpful. In the US, in the US, I had found there's Christian counselors and therapists. There's an organization that helps you find if religion is important to you or you want to do things in that context, you can actually find groups specifically of Christian counselors and therapists or minority counselors and therapists, because it's good to have a therapist who understands your cultural context, and that can be very hard to come by. But there's now more like groups and resources. Even here in the UK, if you specifically want a Black therapist, they're now resources that you can go to be directed towards somebody from your own culture and background. And even within the NHS, they're now more sensitive to that, so you can actually specifically ask for somebody from your background. And another thing I found actually in seeking help, just because I've had some pretty bad experiences with doctors, is I always ask upfront if they're open to holistic care and how they feel about me taking herbs. So it's very important to find a doctor or a therapist who's open to alternative. If you're into alternative therapy, which I highly recommend, then you always want to match yourself up with a doctor or a therapist who's okay with you using the alternative therapy and who even knows something about alternative therapy and allows you to take a more holistic approach rather than just giving you lots of medicines and increasing your medicine and telling you always need to be on medicine. My first doctor told me I would have to be on lithium for the rest of my life, which turned out to be a misdiagnosis. And I'm now actually coping without any medication. So I would recommend just really being proactive about finding a doctor who's leaning towards the type of care that you prefer. Yeah, the Calm app is good. There's lots of meditations through Calm. Have you adopted or can you recommend any particular coping strategies with difficulties of the pandemic and the anti-Black racism of this year? So for me, I had joined the newsletter for the Imperial College Chaplaincy Center. We have a multi-faith chaplaincy center, and I found that extremely useful. They sent out, they've been doing meditation and offering prayer support, and they have particular recorded meditations, and I've been doing special sessions specifically for the pandemic. And that's basically what led me into really getting into the mindfulness, because I just found the prayer and the meditations that they were offering really useful. So I've cut off a lot of things. I took myself off a lot of WhatsApp groups and things that were agitating me, and actually cut off a lot of family. People were really panicking at the beginning of the pandemic. So just for the sake of my own sanity, I've kind of limited a lot of that. And then I've really geared towards the mindfulness and getting all the support I can get through our multi-faith center, and just building a really calm environment in my room, and just being very mindful about the people I interact with. So being interacting with groups and people, even online, that are positive and are giving positive energy, if that's helpful. So Calm Up is good. Some universities cover the cost of it, yes. Use UPA, that helps. Yes, a lot of helpful advice in the chats. Yep. Thank you. Well, thanks everybody. Thanks for attending. I know that it's a very strange time. So there are links to all the different things I mentioned within the PDF, and a lot more, a few more recommendations within the chat. And I shall hand over back to the moderators and put my headphones on and hopefully hear you. But thank you very much.
Yeah, thank you for joining us for this event. If you signed up for the yoga event, you can go ahead and hop over. We're about to get that started. So we hope to see you in our next event. This information will be up on our website with all of the links and this recording, so that you can have this for future reference, because there's a lot of great nuggets in here. So have a great rest of your day. If you happen to not join us for either our yoga event, which is next, or for our Black and Immuno party, which is in a couple of hours. And yeah, we'll see you soon. Thanks, guys.